Is it possible that something is quietly happening with your heart? Something you might not even recognize. We often think of heart trouble as sudden, dramatic chest pain, the kind you see in movies. But especially after 60, your body might try to tell you something is wrong in much subtler, stranger ways. It's a difficult reality to face. The idea that our bodies change as we age. And what felt normal a few years ago might now be a sign we need to pay closer attention. Many of us dismiss little changes, thinking it's just part of getting older, just slowing down a bit. But sometimes, those little changes are actually your heart sending you a message, a signal it's working harder than it should be. The secret is knowing what those less obvious signals are. In this video, we're going to look at 6 strange symptoms that can reveal your heart might be in trouble after 60, symptoms that are often overlooked or mistaken for other things. Understanding these signs is crucial because catching potential heart issues early can make a world of difference. It's about being informed, not alarmed, and taking proactive steps for your health. So, please, stay with me. Watch to the end for something that will surprise you about protecting your heart. Now, let's talk about the first strange symptom that many people just brush off as age catching up with them. And that's unusual or overwhelming fatigue. We all get tired, of course, after a busy day, or maybe just not getting enough sleep. Feeling a bit drained is normal, but I'm talking about a level of tiredness that feels different, more profound, and often unexplained. Imagine finding yourself utterly exhausted after doing something you used to do easily, like walking to the letterbox or putting away groceries. Or perhaps you wake up after a full night's sleep and still feel completely drained, like you haven't rested at all. This isn't just feeling a bit sluggish. It's a deep, bone-weary fatigue that interferes with your daily life. You might find yourself canceling plans because you just don't have the energy, or struggling to get through simple tasks that were once second nature. Why is this a potential sign of heart trouble? Well, when your heart isn't pumping blood efficiently, your body's organs and tissues aren't receiving enough oxygen and nutrients. Your body, in essence, is constantly struggling to get the energy it needs, even when you're not exerting yourself. Think of it like trying to run a car on a sputtering engine. It's working overtime just to move, and you feel that strain as overwhelming fatigue. This kind of fatigue can come on suddenly, even weeks before other more typical symptoms might appear. It's particularly concerning if this fatigue is new for you, or if it has worsened significantly. Pay attention if you feel this deep exhaustion not just after physical activity, but even after minimal effort, or if it's persistent despite adequate rest. It's easy to say, "Oh, I'm just getting old." But if this fatigue is truly limiting what you can do or feels unlike any tiredness you've experienced before, it's worth investigating. It's your body telling you something is off. And sometimes, that off feeling points straight back to your heart. Moving on to another symptom that many might initially dismiss, and that's swelling in your legs, ankles, and feet, also known as edema. Have you ever noticed that your socks leave deep indentations in your skin at the end of the day? Or maybe your shoes feel tighter than usual, especially towards the evening. This swelling isn't just from standing all day, although that can contribute. When your heart isn't pumping effectively, it can cause fluid to back up in the lower parts of your body, thanks to gravity. This is because the weakened heart struggles to push blood back up from the extremities. The fluid leaks out of the blood vessels into the surrounding tissues, causing puffiness and swelling. It can make your skin look stretched or shiny. If you press on the swollen area, it might leave a temporary indentation, like pushing into dough, which is a classic sign of this kind of fluid retention. This swelling tends to be worse later in the day and can improve overnight after you've been lying down, and gravity isn't constantly pulling fluid downwards. While there are other causes for leg swelling, such as venous insufficiency or even sitting for long periods. Persistent swelling, especially if it affects both legs and is accompanied by other symptoms we're discussing, is a strong indicator that your heart's ability to pump blood might be compromised. It's like a plumbing issue. If the main pump isn't strong enough, water starts backing up in the lower pipes. This swelling might start subtly, just a slight puffiness, and gradually become more noticeable. It can sometimes even extend up into the calves or thighs. Don't just assume it's nothing or simply due to warm weather or being on your feet. If you're noticing this kind of persistent, unexplained swelling, especially if it's getting worse, it's a sign your heart may be struggling to keep things flowing properly throughout your body. It's definitely a symptom to bring up with your doctor. Now that we've touched on that unusual tiredness and the swelling that can appear, let's look at a third symptom that can be quite unsettling: shortness of breath, particularly when you're resting or lying down. We all understand getting a little winded after strenuous activity. That's normal. But what if you feel breathless just sitting in your armchair, or you find yourself needing more pillows at night to prop yourself up so you can breathe comfortably? This kind of breathlessness, medically termed dyspnea, especially when it occurs without exertion, can be a significant sign of heart trouble. When the heart isn't pumping blood effectively, pressure can build up in the blood vessels leading to the lungs. This causes fluid to accumulate in the air sacs of the lungs, making it difficult for oxygen to get into your bloodstream and for carbon dioxide to be removed. It feels like you can't get a full breath, or like you're constantly trying to catch up on air. This symptom can be particularly noticeable at night, a condition sometimes called paroxysmal nocturnal dyspnea, where you might wake up suddenly feeling breathless and needing to sit or stand up to catch your breath. It's a frightening experience and a clear signal that something isn't right. You might find that activities you used to do without a second thought, like walking across the room or getting dressed, now leave you gasping for air. If you find yourself avoiding stairs or shortening your usual walk, not because you're tired, but because you feel breathless, it's important to pay attention. This isn't just being out of shape. It's a potential sign that your heart is struggling to keep your lungs clear and supplied with adequate blood flow. Don't dismiss it as just getting older or being a bit heavier than you used to be. Persistent or worsening shortness of breath, especially when resting or lying flat, is a symptom that absolutely warrants medical attention. It's your body telling you the fundamental process of getting oxygen is being compromised, and often, the heart is at the root of that problem, closely related to the shortness of breath. And another potentially strange symptom is a persistent cough or wheezing that just won't go away. Now, obviously, a cough is common with colds, flu, or bronchitis, but if you have a cough that lingers for weeks, doesn't seem tied to a respiratory infection, and especially if it gets worse when you lie down, it could be related to your heart. This kind of cough is often described as a dry, hacking cough, though sometimes it can produce pink or white mucus. Again, this is linked back to that fluid buildup in the lungs we just discussed. When the heart isn't pumping efficiently, fluid can accumulate in the lungs, irritating the airways and triggering a cough reflex. The wheezing sensation can occur for similar reasons. As the fluid buildup can narrow the airways, it might sound like a persistent bronchitis, but without the typical signs of infection. You might find yourself coughing more when you're trying to sleep or when you're lying flat. It can be particularly frustrating because cough medicines don't seem to help. If you've had a cough or wheezing that doctors initially thought was bronchitis or allergies, but it hasn't improved with standard treatments, or if it comes and goes in a pattern that doesn't fit typical respiratory illnesses, consider the possibility that your heart might be contributing. It's a less common presentation of heart issues than chest pain, but it's a vital one to recognize, especially in older adults where symptoms can be less typical. This cough or wheezing is another way your lungs are reacting to the congestion caused by a struggling heart. It's a sign that the plumbing system, specifically how fluid is managed between your heart and lungs, is facing difficulties. If you have a chronic cough or wheezing that doctors haven't been able to definitively diagnose or treat, or if it occurs alongside other symptoms like swelling or unusual fatigue, it's definitely worth asking your doctor to consider your heart as a potential cause. Moving on from those respiratory signals, Let's talk about another symptom that might seem completely unrelated to the heart, a loss of appetite or nausea. You might find yourself feeling full very quickly after eating only a small amount of food. Or perhaps you lose interest in food altogether. Some people experience a persistent feeling of nausea or even abdominal discomfort. How could this possibly be connected to your heart when your heart isn't pumping blood effectively? It affects circulation throughout your entire body, including your digestive system. Fluid can build up around the liver and intestines, causing swelling and interfering with normal digestion. This can lead to a feeling of fullness, bloating, and nausea. Your body might also divert blood flow away from non-essential areas like the digestive system to try and preserve function in more critical areas, which can further impact appetite and digestion. Think of it like trying to water a large garden with low water pressure. Some areas won't get enough water, and the overall system struggles. In this case, your digestive system isn't getting the optimal blood flow it needs, leading to these uncomfortable symptoms. You might notice weight loss because you're simply not eating as much, not because you're trying to. This symptom can be easily mistaken for a stomach bug, digestive issues, or just a general lack of energy often associated with getting older. However, if this loss of appetite or nausea is persistent, unexplained by other digestive problems, and especially if it occurs alongside any of the other symptoms we've discussed, the fatigue, the swelling, the breathlessness, it's another important clue that your heart might be the underlying issue. It's a less commonly known sign, but one that points to the systemic impact a weakened heart can have on your body. And finally, let's touch upon the symptom that many people do associate with heart problems, but often imagine only in its most dramatic form: chest discomfort. While classic, crushing chest pain is a well-known sign of a heart attack or other serious heart issues. After 60, chest discomfort can manifest in much subtler ways. It might not be a sharp pain at all. Instead, it could feel like pressure, tightness, squeezing, fullness, or even just an ache in the chest. This discomfort might come and go, or it could be persistent. It might also radiate to other areas, such as the arm, jaw, neck, back, or even the stomach, for women, especially, and older adults in general. Heart symptoms can be atypical, and chest discomfort might be less severe or present differently than what's typically described. You might feel it as indigestion or heartburn that doesn't improve with antacids, or as a general discomfort you can't quite pinpoint. It's crucial to understand that any new or unusual discomfort in the chest area, even if it's not severe pain, should be taken seriously, particularly after age 60. This is the most direct signal your heart can send when it's not getting enough oxygen, often due to narrowed arteries. While the classic image is someone clutching their chest in agony, the reality can be a more diffuse, less intense feeling of unease or pressure. If you experience any kind of new, unexplained discomfort, tightness, or pressure in your chest area, or if existing discomfort changes in frequency or intensity, it's important to seek medical attention promptly. Don't wait for it to become severe pain. Recognizing these varied forms of chest discomfort is vital because early intervention for heart issues is absolutely key. So, we've looked at things like that unusual, overwhelming tiredness that doesn't go away, the swelling in your legs and ankles, breathlessness even when you're resting, that stubborn cough or wheezing, unexplained loss of appetite or nausea, and even chest discomfort that isn't always a sharp pain. These 6 strange symptoms: unusual fatigue, leg swelling, shortness of breath, persistent cough, loss of appetite, and varied chest discomfort, are all signals your body might send when your heart is struggling. Especially as we get older and symptoms can be less typical, it's easy to dismiss these as just normal signs of aging, or blame them on other minor ailments. But being aware of their potential connection to heart health is incredibly important. Recognizing even one of these symptoms, particularly if it's new, persistent, or worsens, should prompt you to have a conversation with your doctor. They are the best person to evaluate your symptoms. Consider your overall health history and determine if these signs are indeed related to your heart or something else entirely. Remember, you are your own best advocate when it comes to your health. Listening to your body and seeking professional medical advice when something feels off is one of the most powerful things you can do. Don't hesitate to describe exactly what you're feeling, even if it seems strange or minor to you. Being proactive and catching potential issues early can truly make a significant difference in your long-term health and quality of life. Small changes in awareness and seeking timely medical evaluation can dramatically improve outcomes. You know your body best. Pay attention to its signals, even the subtle or strange ones. If you found this information helpful or learned something new about these lesser-known heart symptoms, please consider giving this video a thumbs up. Your support helps us reach more people who might benefit from this information. And if any of these symptoms resonated with you, or if you've experienced other unusual signs that turned out to be heart-related, sharing your experience in the comments below could be incredibly helpful for someone else watching. Don't forget to subscribe to the channel for more videos dedicated to helping you understand your body and live your best. Healthiest life after 60. Remember, your health journey is a marathon, not a sprint. And being informed is your greatest advantage. Stay vigilant, stay healthy, and keep living your life to the fullest at every age.